Hello, my name is Miguel Zugman. I'm a research fellow at City of Hope, where I joined after completing my medical oncology training in Brazil at the Albert Einstein Hospital in São Paulo. My poster presentation at this year's ASCO highlights the long-term outcomes of patients who received CBM-588 along with doublet checkpoint inhibitor first-line therapy for renal cell carcinoma. CBM-588 is a bifidogenic live biotherapeutic product which we postulate to have the capacity to enhance response to immunotherapy. The study scheme allowed the inclusion of patients with measurable metastatic disease, clear cell and/or sarcomatoid features, no prior therapy, and IMDC risk category intermediate or poor risk only. Patients were then randomized in a 2-to-1 fashion to receive nivolumab and ipilimumab with or without CBM-588. The primary endpoint of the study was the change in bifidobacterial abundancy on week 13 of therapy, which was negative. Here, we'll focus on the secondary clinical outcomes, especially overall survival, which is first reported in this presentation. A total of 29 patients were included in the trial, 10 in the standard of care, and 19 in the combination of Nivo-IPI and CBM-588. Patient characteristics were balanced across the study arms, also in regard to the presence of sarcomatoid features and IMDC risk scores. Regarding overall response, the combination of Nivo-IPI plus CBM-588 showed a 58% response rate, compared to 20% with Nivo-IPI alone. There were also more cases of primary progression with Nivo-IPI compared to the combination with CBM-588. Here are the long-term results. With a median follow-up of 60 months, the median PFS was 38.2 months in the Nivo-IPI and CBM-588 arm versus 21.1 months in the nivolumab ipilimumab without CBM-588, with a hazard ratio of 0.26 and a p-value of 0.004. The median overall survival with Nivo-IPI plus CBM-588 was 55 months versus 34 with nivolumab ipilimumab alone, with a hazard ratio of 0.4 and a p-value of 0.087. Therefore, we conclude that despite the small sample size, Nivo-IPI plus CBM-588 showed promising improved clinical outcomes compared to Nivo-IPI alone. Response rates and survival outcomes exceeded historical benchmarks, and ongoing clinical trials are further evaluating CBM-588's impact in the treatment of renal cell carcinoma. Thank you, and come by our poster on Monday. See you there.